Okay, so hello, I'm Dr. Anusha, one of the junior doctors in GP clinic. I'll be your doctor today. So can I please confirm your full name and date of birth?
Yes, doctor, my name is Alex and I was born on the 20th of March, 1994.
Okay, Alex. So what pronouns do you go with?
Well, I go with her, she.
Okay, I go with the pronouns she and hers as well. Okay, so what brings you to the clinic today?
Yes, doctor.
Hello, doctor.
Well, doctor, when I woke up in the morning, I started having.
You're gone again.
Chest pain and.
Okay. The line is not proper. You're gone again. I lost you again.
Dr. Anusha, can you hear me?
Yeah, you've been going on and off.
Okay, can you hear me right now?
Yeah, we can start. If you want to start again?
Yes, please, definitely. Okay.
Okay, recording.
Okay.
Again.
Hi, I'm Dr. Anusha, one of the junior doctors in GP clinic. I'll be your doctor today. So please can I confirm your name and date of birth?
Yes, doctor, my name is Alex and I was born on the 27th of March, 1994.
What pronouns do you go with?
Well, her and she.
Okay, I go with the pronouns she and hers as well. So what brings you to the clinic today?
Well, doctor, I woke up in the morning and all of a sudden I started having shortness of, like I couldn't breathe. It was very difficult for me to breathe. And I've had this problem for, a week now, but I never thought that I should, it's going to be so bad that I'll be coming to the clinic. Along with that, I do have some chest pain. So this is why I thought that I should come and seek help.
So could you please, so you told me that you have breathlessness and chest pain. So both for a week?
Can you come again?
You said you have chest pain and breathlessness. Do you have both for a week?
Yeah. Both of them started for the week. Previously, I had chest pain, but it was not that much. But now I am having this, difficulty to breathe, and this is why I'm here. That's the main reason I'm here.
Okay, and could you tell me a little more about breathlessness?
Well, doctor, the thing is that, when I'm just lying down, it gets worse, the breathlessness, and, it's like difficult for me. And I'm also using like lots of pillows these days. And,
Okay.
Now I can't even walk because I have to stop and catch my breath.
Okay, fine. So does it increase on bending forward?
Yeah, it does. It does, kind of.
Okay, and does it increase on sleeping, supine, like straight?
Yeah, it does. It does. I can't sleep straight. I have to use lots of pillows.
Okay, yeah, as you said, thank you. And where's your chest pain exactly?
It's almost all over the chest. It's very vague. It's not that pronounced, but the main problem that I came here was my shortness of breath.
Okay, fine. So the chest pain is not much bothersome, but is it a kind of dull pain?
Yeah, almost a dull pain.
Okay, and then did you have any fever with it?
No, doctor, not that I noticed, but I feel kind of, like I feel bloated, but I don't think I have fever. No, I haven't checked really.
Okay, and do you have any cough?
Yeah, I've been coughing a little.
Okay, and do you have any sputum? Do you have any phlegm?
No phlegm.
Okay, fine. So it's only the breathlessness, right? Without much of any other symptoms.
Yes, doctor.
Okay. And have you lost any weight recently?
No, doctor, not that I've noticed.
Okay. And do you have any lumps?
Weight, I've kind of gained weight because, you know, I've been taking these transdermal patches as I've been changing my gender from a male to become a female. Right now, I go by the name of Alex, but, you know, I've been taking these patches and I think I've kind of gained weight rather than losing it. I've gained weight.
Okay, I'm so sorry that you are going through, like, you know, a lot of symptoms. That must be very distressful for you. Meanwhile, you told me about the patches. So, did the GP prescribe them for you?
Yes, yes. My GP prescribed me like a month ago, and I've been using it since then.
Okay, so just a couple of questions. Has this breathlessness ever happened to you before?
No, doctor. This is the first
You
time.
Okay, do you have pain in your calf?
You know, now that you mention it, I do feel a little pain in my right calf.
Okay, fine. And do you have any, like, you know, do you have any history of such things? Like, did it ever happen before?
No, doctor. This is the first time.
Okay. Are you diagnosed of any serious medical condition?
No, doctor. I'm healthy.
Okay. Did you travel, like, you know, which required you to be sitting at one place for a long time?
No, doctor. No travel.
Any recent surgery?
No, doctor.
Okay, fine. So, thank you for, you know, being with me and, you know, for answering my questions. So, couldn't you please examine me?
Yes, doctor.
So, I would like to, I will have a chaperone with me. I will ensure your privacy. I would like to do your general physical examination. I would like to see the observation, and I would also like, you know, do a few initial investigations. You know, I would send for initial investigation. Is that okay?
Yeah, please go ahead.
Okay, I'll send for an initial D-dimer investigation. Is there any findings?
It's kind of raised.
Okay, fine. Okay. So, from the history and from my examination, I know you got estrogen from the GP, but then, you know, as he must have already warned you, sometimes it can cause, you know, a little clots in our system. Are you getting me? Hello, Alex?
Doctor, I don't quite understand. I don't quite understand what you mean.
I'll explain you. What happens is usually the estrogen can cause a little thickening of blood, and at times it can clot in few places.
Okay. All right. And is it dangerous? I mean, am I going to die out of the shortness of breath?
Anna, let's just come to that. This can be a quite serious condition and can still potentially fatal if not treated. Okay?
Okay. All right.
See, so now you're in the GP clinic. So what I'll do is I'll call you ambulance immediately. Okay?
Okay.
And I'll be sending you to accident and emergency.
Mm-hmm.
And they'll be doing the CT scan right away for you.
Okay, doctor. All right.
Okay? Okay? And you might have to be admitted. Is that okay with you?
I think all right. I mean, as long as I get better soon.
Okay, did you drive here alone? Do you have anybody with you?
No, doctor. I came on my own. I drove here.
Okay, if you want to ask anybody to come, or do you have any, this thing, please finish off because you might be in the hospital for like a couple of days.
Yes, I have a friend. I have a support group. I mean, we all are, you know, just trying to promote our trans people. So I could ask them for help. They definitely come.
That's really great. So please find help and please, like, you know, you need to be in the hospital. Don't be scared. A timely intervention can, you know, cure you completely. Okay.
All right, doctor. Thank you so much. I think
okay. And time is left?
No, you still have time. You still have 30 seconds.
So after this, they'll also put you on blood thinners in the hospital. Okay.
All right.
So that will prevent you from having, you know, further episodes.
Okay.
You'll be monitored for something called INR.
Mm-hmm.
And then, you know, your medicinal, you know, dosage will be stabilized depending upon the INR value.
Okay.
Okay. Okay then. So
All right, Dr. Shetty, the time's up.
yeah.
You did really, really good. You did manage well. You did do the history on time. There were some things that you missed. Apart from that, the empathy part, just there, I was thinking that if you could just, your IPS, if you could increase a little more of the IPS,
Okay.
where,
Okay.
yeah, right? Like when he says that, he is changing
Yeah.
his gender, there you could show a little bit of more IPS, right? And then he
No,
said that,
the thing is, this is an emergency situation. So I think we should have to be in the A&E rather than GP clinic.
That's true. That's true. But when we were also practicing MI, so there the person came with an MI, and this can happen, right? That the person can be in the GP clinic. They could come there. That's like I said, it was a well-manned clinic, right? As even though it's written GP, but it was like a well-manned clinic, and they can
No,
come.
but then
That's what we learned earlier.
isn't he having a
So
pulmonary
you're going to
embolism?
yes, 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 and you're going
So
to
like
refer
it's
them, which you
emergency.
did good. Which you
Okay,
did good. It's an emergency. Definitely you did good. Just a little bit on that part where, like the
Yeah,
person
yeah.
just said that, he's gaining weight and all that. Then you said, I'm sorry to hear that. There's nothing to be sorry about, because, the main thing about, even though it's an emergency and even though the person's having these changes, why would you be sorry? Right? That's what the GMC says, like that. Do not use the words which are inscribed and inculcated in your memory that you've commemorated, right? Like, do not use those words. For example, if a patient says that I'm having some weight gain and I'm also having some other problems and all, then there is nothing to be sorry about. I think the only time you'd say sorry is when somebody in their family has died, or if they have been diagnosed with something bad. Here you can say that I can see you are in distress because of the condition that you're going through, right? The word distress is far better, or any other word, instead of saying sorry, right? Because we're going to save the sorries for the hard things. That's what I think, right? Apart from that, everything else was fine. And also, because this was an emergency situation, you did not ask about the smoking or the alcohol history. But if you feel like, if the person is, wherever you didn't, and that's all right, okay. And you're also going to tell them that you're going to what would you tell them about the patches? What would you tell them about the patches? Should they be continuing it, or should they stop it? You didn't say
Actually, with the
anything about that.
patches, the patches are safe. They do not actually cause much of the time pulmonary embolism unless the person has predisposition to it. So that's why this person, like in real sense, might have got estrogen from the road, from the street. So that's why he might be getting embolism. But patches are usually low dose, and usually they're not supposed to cause. That's what I thought. So I didn't want to stop it.
Okay. All right. So you're saying that it depends on what? Couldn't catch you. Sorry.
If it usually the people who change, right, they do not seek medical attention because they want it to be secret, right? Because
Yes.
because they have like a GP for like 1,000 population or something like that. Like there's so many GPs, so everybody knows each other, and a GP knows you from birth till death if you are in the same place.
Okay.
So many places people don't want to like go and come out that they are transgender. They want to keep it a secret.
Okay. But the thing is, Dr. Shetty, when you were explaining to them that you were having this condition, this pulmonary embolism, and that was because of the patch. What I have read from the notes is that the patches do not increase the risk of pulmonary embolism. I mean, it's not proven.
What if the person is already predisposed to it?
What?
What if the person is already predisposed to it? Some people have increased chances of clotting, right?
Yeah, that's true.
Yeah, I think that's the only time when they actually even people who take like normal OCPs can have pulmonary embolism. Like not everybody has, but then people can have.
All right.
Okay, thank
Dr.
you so
Shetty,
much for giving the nice
No.
to me.
That's all right. That's all right. But one thing is that you did not. Everything was good, like the management, etc. That you told them, we're going to admit you, right? And we're also going to send the investigations, and you did send these investigations. But while you were examining, you just said the general physical examination. I didn't think you said specifically the chest examination, right? Because if you don't say that, the examiner is not going to tell you that they've got coarse crackles. So I guess that's also important in the part of data gathering, right? That's just a little bit. Apart from that, if this was in GP clinic, obviously you'll be telling them, that you must have been told that these transdermal estrogen gel patches, etc., can have the side effects like cold symptoms, stuffy nose, sore throat, weight gain, joint pain, nipple discharge, and and do not apply them on sunburned area or on the breast, right? So, and also we need to ask them if they were on any blood thinners or if they were on any antibiotics, right? So if they was in the GP clinic. Apart from that, I guess the history was good, the management was good, everything else was just to the point, as far as I'm concerned.
Thank you so much.
No worries, Dr. Shady. Anybody else wants to do it? We're going to do another scenario now. We're moving to the respiratory part, right? So I'm just going to change the scenario and then we can practice, right? And if anybody would want to be the patient, I'll be more than happy because I want to practice too, right? Or anybody who wants to be the doctor, it's all up to you. Because all I want to do is that we practice almost daily, right? That's what I really want. So I'm just going to change the scenario a little. That this person is 70 years old. Okay, and they've come in with, because we're doing respiratory now, right? So they've come in with dry cough. They've come in with dry cough, and they're 70, they are in the respiratory department, right? Like they're in the respiratory department. We can just say he's in the GP clinic, and they're 72, and they're coming in with dry cough. So how do we deal with them? Right, they're just coming in with cough. "70 years old, Alex, dry cough." What we have to do is we have to take their history, assess them, and like manage them. That's all there is. So who's interested in doing it, please let me know. Otherwise, if I need to be the doctor, the patient, we can do that. Okay, so who would want to be the patient or the doctor? There's 70-year-old Alex. He's coming with dry cough. He's coming with dry cough. Who wants to do this scenario? Anybody who wants to practice, or anybody who want to come up? Okay, Dr. Ria, do you want to do this?
Hello. Can you hear me, doctor?
Yes, I can definitely hear you.
Okay, thank you.
So, are you interested in doing this?
Yes.
Okay, whenever you're ready, we'll just start, right? This person is 70 years old and he's come in with dry cough. And whenever you would be ready.
Yes, I am ready, doctor.
Okay.
Yeah.
Like start.
So shall I start? Hello?
Just give me a minute, Dr. Ria. I'll just be setting the timer and then we can.
Yes.
Can you hear me, Dr. Ria?
Yes, I can hear you, doctor.
Okay. Just a minute. All right, doctor, whenever you're ready, let's just start.
Yes,
Should we
I am
start?
ready, doctor. Yes.
Okay. All right.
Hello, good morning. Hello, good morning.
Good
I am
morning.
Ria, one of the doctors in GP clinic. May I confirm your name, please?
Yes, doctor, my name is Alex Smith.
All right, nice to meet you, Alex. Can you please confirm your age for me?
Yes, doctor, I'm 70 years old.
All right, so how can I help you today?
Well, doctor, I've come because, for the past few months,
Uh-huh.
I've been having some cough. I've been having some cough for the past few months, and
All right.
I'm here.
Yeah, okay. Can you please tell me about the cough, Alex?
Well, doctor, I've been having it almost all the time. Previously, it was just on and off. Now I've had it all the time. It gets worse. And,
All right.
I just thought that I should come and see you about it.
Okay, so you're noticing that it is getting worse, right?
Yes. So
Mm.
yes, yes.
And have you noticed anything else with the cough?
Well, apart from that, nothing else. Nothing else.
Mm-hmm.
Just I feel like that, cough is very bothersome, and previously it was just, on and off, but now it's there throughout. So
Yeah.
that's just what worries me the most.
Mm-hmm. And is the cough associated with phlegm,
Doctor, what is that?
sputum, like you get sputum when you cough?
No, doctor, no, not at all.
No, nothing. And have you noticed any fever recently?
Uh, Well, it's been there, but it
Mhm.
just comes and goes. It comes and goes.
All right. And have you noticed any change in your weight, that you lose weight or gain weight these days?
Yes, doctor. Yes, my clothes they've got a little loose.
Uh-huh. All right. And how is your appetite, Alex?
Well, I don't want to eat anymore. I don't feel like eating. These days it just doesn't
Mm-hmm.
work for
Mm-hmm.
me.
Uh-huh. And have you noticed any lumps or bumps in your body?
I don't know. I haven't checked thoroughly.
Mm-hmm. Uh-huh. All right. And have you been diagnosed with any medical conditions in the past?
Yes, I suffer. I do have hypertension. Yes, I have been diagnosed with high blood pressure, and for that I've been taking, this Ramipril, and I try and take my medications all the time, and I'm very
Mm-hmm.
serious about it.
Uh-huh. And do you visit your GP regularly?
Yes, doctor. Yes.
Yes. All right. And other than this medicines, are you on any other regular medications?
No, doctor. Not at all.
Any over-the-counter or herbal medications?
No, doctor.
Mm-hmm. And are you allergic to any medications, Alex?
No, doctor.
All right. And have you been hospitalized in the past?
No, doctor.
Any past surgeries?
No, doctor.
All right. And is there any relevant medical conditions that I should know about that is running in your family?
No, doctor. Not that I know of.
All right, Alex. Now I'll ask something about your lifestyle as it might be related. All right.
Yeah, sure. Go
Do
ahead.
you do you smoke?
Yes, doctor. I've been smoking for the past 30 years now.
Mm-hmm. What do you smoke, Alex?
Well, I've been smoking cigarettes, tobacco
Mm-hmm.
cigarettes, and
Mm-hmm.
I smoke them around, like 2 or 3 packs. And
Mm-hmm.
I can't live without them.
All right. Have you ever tried cutting down on the cigarette?
Well, I tried, but it didn't work out. So here I am.
Uh-huh. Mm-hmm. And do you consume alcohol?
No, doctor. I don't like taking alcohol.
Uh-huh. All right. And what do you do for living, Alex?
I'm a gardener. I'm a gardener.
Gardener. All right. And have you been exposed to, by any chance, to asbestos or anything like that?
What is asbestos, doctor?
Like when you work as maybe, you know, some in your work.
No, doctor, I don't understand.
Kind of dust when you work.
Yeah, there is, this garden has soil, so there is dust, definitely.
All right. Um, all right, Alex. So I'd like to do some tests on you so that I'll be able to see what is going on wrong with you. All right.
Yeah, please.
So I'd like to do a general physical examination, examine your chest.
Mhm.
All right.
Okay.
And also like to do some routine blood investigations, take a chest X-ray and ECG as well.
There's opacity on the chest X-ray. There's a big opacity on the chest X-ray. Everything
Alright,
else
okay.
is normal except that is, you know, you can hear some crackles in his breathing.
Oh, all right. All right, Alex. So, do you have any idea about what is going on wrong with you?
I don't know, doctor. I'm just really worried about this cough. And I just don't really understand
All
what to
right.
do about it.
So, from the assessment, I think the condition you are suffering from is not that good.
What do you mean, doctor?
Do you want someone to be with you so that I'll be able to talk further?
What does that mean, doctor?
It's like you told that you are losing weight these days and you have got this cough for some months now. So I think it can be lung cancer.
Doctor, you're saying I have cancer?
At this point of time, I'll not be able to confirm it. But however, from the assessment, what I probably think is more of a lung cancer. But we have to do a bit more, some more
Doctor,
tests to confirm
I
it.
don't really know what to say. I mean, how could this be? How could this be, doctor? I mean, I just don't understand the situation. I mean, it's very difficult for me to, you know, just think about it. I mean, all right, okay.
I can see that Alex, you're distressed now, but let me assure you that we'll do what we can, and you are the best hands. All right.
All right, doctor. Okay.
So do you? So what? Do you want to know what we are going to do now?
Yes, doctor, please.
For now, we'll be referring you to the specialist in 2 weeks' time. All right.
Okay.
And we'll be giving you some medicines for your cough now, and then I'll be referring you to the specialist in 2 weeks' time. I'll be talking to my seniors as well regarding your management plan, and we'll come back to you if there is, and with the management. All right.
Okay, doctor. All right.
Move on to the next station.
All right. Okay. Dr. Riyad, the time's up.
All right.
Was I a bad patient?
Sorry.
Was I a bad patient?
No, doctor.
Because, you know, you just said that I've got, what's phlegm, right? Asbestos. Maybe they know, but this person is a gardener, right?
Yeah.
This person's a gardener. It's less likely he knows what asbestos is. It's less likely he understands what phlegm is, even though he lives in the UK, but he wouldn't know, right?
Okay.
So even though you got to the conclusion that, you know, he might be having lung cancer, but blurting it out to the patient, you know, without, you know, the proper
Layering,
explanation. A proper explanation, proper language wouldn't work out. Even though you asked the correct and relevant history, you asked him about, you know, his present income plan, you explored it, you asked about whether he's got any fever, you know, you tried and ruled out the major things, right? You even asked about the past medical history, right? And even though you asked like lots of questions when the patient said they doesn't have anything, you kept on asking any other medication, any other, if you were ever hospitalized. If he was not hospitalized, it's less likely he had a surgery, right? It's less likely, but you still asked, right?
Okay.
Okay, so right, so I mean, you were asking good questions. So, and there is a thing when the person said that, that he's having hypertension, and then they said that they take the medication on time, you are supposed to appreciate them, because that's where your
Yes.
IPS comes in,
Okay,
right?
okay.
Even if we don't understand how to lay on the news, our IPS can save us, right? Our interpersonal skills can save us, right? So when the patient said that, I'm having I'm having hypertension, and I'm really just taking care of it, and now you were just worried about if he goes to the GP. Yes, he does go to the GP, but this is what they say.
Yeah.
Active listening is really, really important in plab2, that you are going to listen to what they said, right? So they said that I was, compliant with my medication, and I was just very good with it. So you're supposed to say that I'm
Oh,
thankful and I must appreciate it. It is rare, but I'm grateful that you're doing it. Then he told you that he's smoking, right? Then you asked him that is there a way, or is there any ways that you've tried to reduce smoking, right? So he said no. Then you said, all right, no, you're supposed to ask that, like, if you have asked them, then shouldn't you be just helping them out? If you have started off by that, shouldn't you be helping them out? That, if you want at any time, we're here, because you're in the GP clinic, right? We'd be
okay,
here to
okay.
support you and help you, reduce in reducing the smoking, right? You asked the relevant history, you gave a good provisional diagnosis, and you asked them. It was very important to ask them if they have any idea of what is happening, right? Okay. And when you ask them about if there's someone with them, instead of doing that, how about you ask them that, who do you live with, right?
Okay,
Psychosocial is
okay.
important, right? Who do you live with? Psychosocial is really important, because if you just ask, who do you live with, right? There are three things important: ice, right? Then the sinister causes that you just were trying to exclude. For example, night sweats, fever that you were trying to exclude, any pneumonia, because he's very old and he just has a dry
Yes.
cough. So you tried and exclude, and it doesn't have a fever. So you excluded that. Apart from that, you have to ask psychosocial, that who do you live with? Who is there with you to take care of you, right? Because when you do that, then you know that, he's not going to be alone. And when you
Oh,
refer him to
okay.
someone else, right? If you refer him to an oncologist and a specialist within 2 weeks' time, you could say that, and if you're not able to, we just talk to this person or so, and we'd be here to help you out. Because if he doesn't have anyone at home, then you are there. Then you can just ask some friends. If not friends, then someone from the social work. So we have to tell them that we're there for them, right? And apart from that, you did ask about the past history, right?
Yes.
And okay, and then you were telling them, yes, doctor.
Yeah,
Yes.
doctor, when I disclose that he's having cancer, how can I come to that point? Like, I have doubt there. Like,
Yeah,
I
that's
want
true.
to tell that if.
So yeah, I was coming to that. That's right. See, here's the thing. What I have learned is that even the GMC error files, right? Like that, I think is the holy grail for us right now. There they say that if you wanna, do something, right? Meaning if you're asking something, make sure you understand the reason for it, right? So you're disclosing to them that they have cancer, and you ask them questions which were related to cancer, right? That they were smoking for past 30 years. When you did their examination, you found out that, there was some problem in his respiration, right? Like there was some dullness in the voice, dullness in the auscultation, right? There was some opacity on the x-ray, right? So you could say, thank you so much, Alex. First of all, before you give them the provisional diagnosis, you can ask them the idea, and you did do that, right? Then you can say, Alex, or whatever his name is, thank you so much for sharing this information. I've done your examination. Well, Alex, sometimes in life, what happens is that things don't go the way we want, right? That is your signposting. But even before that, you can say that, first of all, you have to be very spontaneous, right? You have to be very spontaneous. You have to make sure that you give them time to absorb the news. You have to be slow, right? And you don't have to interrupt them, right? You interrupted them when they were talking. You interrupted them that, is there anyone at home? No, you got to give them time, right? You got to give them time. You got to give them time, right? So when you're breaking the news, you're going to tell them that, based on what you've told me, right? Or, you came in with cough, Alex, and you said that you've been having it for months. Now it's getting worse. And you also, and you also said that you've been smoking and that you've lost some weight. And when I did your examination, I found out that on when I heard your chest, there was some, it wasn't good breathing. And when I did your X-ray, I found out, first of all, in the GP clinic we don't have X-ray. Right, we don't have X-ray in the GP clinic, right? So that's one thing. However, you did that, right? So because when you do the X-ray in the GP clinic, it'll take around 2-3 days before they can come back with the X-ray, right? So immediately, I even gave you the results here, but you wouldn't have them, right? So you're going to do everything on your own. So based on this, and you'd say, based on all that you've told me and the examination that I've done, I feel like the best case scenario is that it might be something benign, right? Something not sinister, right? Like, we're going to use lighter words, that it could be something of a benign sort, right? Like something not so serious. However, the worst case scenario could be, you can also use these words, is that you might be having, not suffering, don't use the word suffering. We've not used this word while we were doing our OET, right? While we were writing lectures, while we were, practicing in any other way, right? They've told us not to use this word. Suffering is, not a good word. They don't like it, right? So instead of that, you could say, I believe, or I believe that what you might be having, you might be, right? We're not so sure. You said that you have cancer, right? Or you might have cancer, right? I believe that what you might have is a condition or a situation which is lung cancer. But Alex, don't worry, we're here for you. We'll make sure that you receive the best treatment. I'm hoping that you're following me. Then give them a pause, right? Give them pause to talk, right? So that's the way you'd be, like explaining things to them. We don't have to rush in this. We don't have to ever rush the patient, right? And yes, we are going to send them to the referral. But first, we need to know that the patient understands that we are here to, be with them, that we're here to manage them, right? Like when we are coming to the management, we're going to tell them that, we're referring them. Then we'll say that I'm going to involve my senior. Then we'll say, when you go there, they're going to do further investigation. That's when you can say that, they'd be doing your chest X-ray. Maybe you'd be going through your CT scan, right? And then you would be talking about your lifestyle management, because he was in the GP clinic. There is where you can talk about the lifestyle management. And, like maybe you'd be involved in the other teams and following up, and then safety net. Yes, Dr. Skipper is saying that if we say that you might be having cancer, because he's a GP. He's a GP. That's what I think, that if he's a GP, and because he doesn't have the X-ray, he's just going to say that, the best case scenario is it could be something not so serious, but what we're suspecting is that you might have cancer, right? We're never going to say you have cancer, because for us to be very sure, because, there are 4 words where we're not supposed to say in plab2, that is should, need, have, and want, right? That you have cancer. We don't say that you might be having cancer, right? That's what I think. That we are going to be throwing ourselves and be cautious when we say words like that. That's what I think, Dr. Skipper. I might be wrong. You can add in whatever you want. Dr. E, are you still there? Because I spoke a lot.
Yes, doctor. Yes, doctor.
I hope this made sense in some ways.
Yes,
I'm just
doctor,
relaying
yes.
what I know, right?
Yes.
Also, when you were talking about asbestos, if you get confused, don't worry. Okay, don't worry. Just say, okay, I don't know how to explain better. Be honest, right? Okay, I don't know how to explain better. I look it up and I'll try and explain better to you. Even though we're not supposed to do that, you could just say, because you're worried, right? You're worried that he might be
Yes, I got
working,
confused.
right? No worries. Just move along. Don't stop there. Because they say that you're supposed to be calm and confident, right? They want to see if you're a safe, good, calm, confident doctor, right? So you are that. Don't just spoil that by staying there. Right?
Okay, doctor.
All right. Okay.
Thank you, doctor.
No worries. I hope I didn't miss something, but do safety net. I mean, how would you safety net for this? I don't think so. We're going to do any safety netting, because it's like a very different kind of scenario. We just started with breaking the bad news, even though he just has cough, and I didn't want to take it that way, but I did took it that way. So anybody else who wants to practice, because then at the end, I'd want to practice. Anybody else who wants to be the doctor? I'll just change the scenario now.
I can be the doctor if you don't mind.
Yeah, definitely. Who is this?
It's me, Chet.
All right. Okay, Dr. Chetan. So,
Can you hear me properly?
sorry.
Can you hear me properly?
Yes. Now I can hear you. Now I can hear you.
Okay,
Just give me a minute. Just give me a minute, and we just start. Okay.
Yeah, no worries.
This person is 34, right? And he is coming with cough, right? This person is 34 and he's coming with cough. And whenever you're ready, we're going to start.
So it's a dry cough, yeah?
Yeah, he's got cough. He's got cough.
So,
I'm not going to even say
okay.
dry cough. I'm just going to say he's coming with cough, right? It could be
Okay,
anything, right? Because
Yeah,
if I say dry cough, it just gives you some clue, and I don't want you to have any clues.
Yeah, no worries. So the name is same, right? It's Alex, yeah?
Yes, it's Alex. Whatever you want to call her. If you want, we can change the name. What's in the name,
Yeah, no worries. No,
Just
I just wanted to be sure. No, I just wanted to be sure if the name is same or
Yeah,
something
that's
different.
right. Okay, we're calling her Rose. She's 34
All right.
years old, Rose. Okay?
All right, no worries.
Okay. Whenever you're ready.
Yeah, I'm ready.
Okay, just give me a minute. I'll be starting the timer. All right, it's Dr. Chetan, right?
Yeah, I'm Dr. Chetan.
Okay, let's start.
Begin.
Hello, is it Rose? Hello.
Okay, can you say that again? Can you say that again?
Hello, is it Rose?
Okay.
Begin.
Hello.
Hello, doctor.
Is it Rose?
Yes, doctor.
Okay. I'm Dr. Chetan, one of the doctors in GP practice. So before we move on, can you please confirm your full name and age for me?
Yes, doctor. My name is Rose Blanchett, and I'm 34 years old.
Okay. Is that all right to call you Rose?
Yes, doctor, please.
Okay. How can I help you today, Rose?
Well, doctor, I've been having cough for the past three months, and it's getting really difficult for me now. And so
Okay.
I thought that I come and seek help.
Thank you. Okay, thank you, Rose, for coming to seek a medical advice. We are here to help you. All right.
All right, doctor.
Can you please tell me a bit more about your cough, please?
Yes, doctor. It's been there for around 3 months, but now it's just getting worse. I mean, it's so bad that I can't even talk properly, and at times, I just have bouts of it, and now it's just getting more worse.
Okay, I'm so sorry to hear about it, Rose. So you mentioned to me that it has been there for last 3 months and now it is getting worse. Is that correct?
Yes, doctor.
Like so far, have you noticed anything which makes your cough better?
No, doctor, not that I know of.
Anything which makes it worse?
Yes, doctor. I mean, not really, but it's almost the same.
Okay, so like it has been like 3 months. So is it like the cough is always there, or it's like coming and going?
No, it's almost always been there. It never goes away.
So like whenever you cough, do you bring up any sputum?
Yeah, at times.
Can you please tell me a bit more about the sputum? Like how does it look?
Well, it's just it's white. I have not really noticed, but recently it was greenish in color. However, that's not my main worry. My main worry is that I've been coughing.
Yes, that is a valid concern, Rose. You must be worried about this cough, as it have been like 3 months. Okay, we will try to figure out. I will try to figure out what is going on. Okay.
Thank you, doctor.
So apart from cough with some sputum, anything else you would like to bring under my attention?
Well, doctor, I've also noticed that, I get fever, on and off, I do get fever.
And since when you are having this fever?
Well, it's been almost the same time.
Okay. So like so far, have you tried to take anything for this fever?
No, doctor, I took paracetamol, but it didn't work.
Okay. So any chest pain by any chance?
No, doctor.
And what about any like cold or any running nose?
No, doctor.
Like have you noticed any kind of pain in your calf?
No, doctor.
Okay. And like talking about your general health, like have you been diagnosed with any medical condition?
No, doctor.
And apart from paracetamol, any other medications you are taking?
No, doctor. I've even stopped paracetamol.
Okay. Thank you for sharing this information with me. And I would like to ask you a few questions about your lifestyle, if that's okay.
Yes, doctor, please do.
So, do you smoke?
No, doctor, I don't like to smoke.
Okay, that's great. And what about drinking alcohol?
No, I don't drink alcohol.
That sounds good. I'm sorry to ask you this question, but this question is important for our consultations. By any chance, do you use any kind of replacement drugs?
No, doctor.
Okay, that's fantastic. Okay. Have you traveled abroad recently?
No, doctor, I am a gardener. I don't have this kind of money to travel abroad.
Okay. So, how are you finding your occupations? Like, is that all right?
Yeah, it's not that bad. I mean, I don't like to be a gardener, but one's got to do what's one's got to do.
Okay. That sounds good. And how about when you are doing your job, like the gardening? So, is there any kind of dusty environment in your job?
Yeah, I deal with soil. There is dust.
Okay. Thank you for this information. So, are you allergic with any kind of any things?
No, doctor, I don't know.
I mean, like any kind of medications or any food or any dust. Are you allergic with anything?
No, doctor, I've never got myself tested.
Okay, fine. So, thank you so much, Rose, for sharing this information with me. So now, if you don't mind, I would like to examine you. Will that be okay?
Yeah, please go ahead.
Well, I would like to check your observations. I mean, your blood pressure, temperature, oxygen saturations, and also I would like to listen to your heart and lung sounds.
Yeah, please go ahead. The person's got.
I'll be providing you chaperone, and your privacy will be maintained.
So the person's got some, crepitations in the lungs on the right side.
Okay. Well, Rose, I would also, like to run some tests for you to get the better understanding of your situations. Is that sounds good to you?
Yeah, doctor, please.
I would like to run some blood tests for you. Things like your blood count, your blood level, inflammatory marker, and how your liver and kidney is functioning.
Okay, doctor.
Well, Rose, have you given any thought what could be the cause of this?
I have no idea. But
anything
I
on that? Yeah.
Friends, one of my friends, he had all this sort of cough, and he used to work with me. As mentioned, as a gardener, he was diagnosed with TB.
Okay.
So he was an immigrant
by any
from Bangladesh, Yeah.
Okay, I see. Okay, so may I ask you if you were in contact with him recently or
Yes, he used to work with me daily. He's still working with me.
Okay. Rose, I'm a bit concerned about your symptoms because as you had been in contact with the patient who was diagnosed with TB, and you are having the cough and the fever on and off. So this could be the one of the symptoms of tuberculosis. Are you with me?
Yes, doctor, I do understand that. Doctor, is there any treatment for this? I mean, what are we going to do right now?
Rose, like this is a very good question. So the good thing is, like we have very good treatment available for this. So we'll be starting you on.
All right. Doctor, say then the
Yeah,
time's up. Doctor said the
yeah,
time's
yeah,
up.
okay. Yeah, I'm
Okay.
sorry. Yeah.
Yeah, no need to say sorry. Your IPS is really good. As far as I know, your IPS is really good, and you were confused about the history because I don't know if you were having some DDs in your head, right? So if you came with a
Mhm.
cough, right? So what DDs can we think of, right? We can think of him having lung cancer, but he's too young for that. TB, right?
Mhm.
Some pneumonia.
Mhm.
Okay, because he was having fever. What else can we think of? We can also think of, any, pulmonary embolism, DVT, right? What else can we think?
Mhm.
What else do you think is there? We
No,
can think,
actually, no,
like,
actually, like I was thinking it could be, kind of uh, atypical pneumonia in the beginning, but when you said that it's greenish color sputum, then I was like a bit confused, like, no, what could be this?
hmm. So the the exact the gardener wouldn't know, right? So if
Mhm.
it's
Yeah,
not
yeah, 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 true, yeah.
at least we can ask him about the sinister things, right? Sinister things meaning, has he lost any weight? Right, he's
Mhm.
34. Has he
Mhm.
lost any weight? Right, he's having shortness of breath
Mhm.
for he's having cough for the past 3 months. So if
Mhm.
he's
Mhm.
lost weight, then if he's lost weight, then you can ask if he's having some sweats, right? If he said he's having
Mhm.
night sweats, he also said he's having fever. So that could have
Mhm.
made you think of TB,
Yeah, yeah,
right?
yeah, yeah, yeah,
You've
yeah.
asked him
Yeah,
travel
completely agree with
history,
you. Yeah.
right? Okay, contact
Mhm.
TB. So you could ask of travel history, but because he's a gardener, yes, Dr. Skipper, please do ask. I don't know who Dr. Skipper is, but please do ask Dr. Skipper. I'll be sharing whatever I know, right? So
Yeah, yeah, yeah,
that's
yeah.
what I was thinking. That like this, like at least we can ask these things. And when you were examining, be confident. Right, that's really important that we be confident when we're telling them that we're going to do this and this and this. How about we say things in order? Right? How
Mhm.
about we
Mhm.
say things in order? And one thing that could have helped here is eyes, right? Even though you asked about
Yeah,
the
yeah.
idea at the end, and they did tell you because you were about to give them the provisional diagnosis, and they did tell you
Mhm.
this is in
Mhm.
these situations, I guess in the GP situations, when we're done with the presenting complaint, that's where we can ask them that is there something because because after your complete presenting complaint, after you've completed the history for the history presenting complaint, and when you are just
Mhm.
coming to the the history of to the past medical history, if after the presenting complaint you're not sure what the person has, then maybe you can say, is there something that you are worried about, what you might think this be, right? Not the idea,
Yeah, yeah,
sometimes the
yeah.
idea on the same, because that way the person might help us out. If during that time we don't know and we're confused, we can ask them and they might help us, right? Because the examiners, I guess, they are there to help us. They don't want us to fail. They want doctors to be there to work, right? But your IPS was really,
Yes,
really
yes, yes.
good. It was really, really good, right? So keep that up,
Yeah, yeah,
right?
yeah, yeah. Thank you, doctor. Thank you so much.
No worries, no worries. And you did run the right kind of test. And like you were asking them that is there any soil around you? I guess uh, doctor has also done the same thing, that they asked them if there is any soil around him. This person's a gardener, right? So we have to be logical here. This person's a gardener, definitely he's dealing with soil, definitely he's dealing with dust. We don't need to ask them things like that, right? So this is where the logic comes in. This is why we don't have to think about what we know. We have to keep an open mind, right? This could be anything, right? So the main DDs that we need to work for if the person's got cough is TB, right? What else can we think apart from TB? We can think of him having lung cancer, right? But he's too young for them. Pneumonia, right? And pneumothorax, also pneumothorax, right? He could be having pneumothorax, but the person would be coming in the GP clinic, right? So that's what I think. Otherwise, I guess you did good, right, Dr. Chetan?
Yeah, yeah, yeah. I agree with you, doctor. So maybe like I was a bit lost in taking out like like because actually TB
Because
was
I
not on
guess
my head.
yeah, because at the head of the,
Actually TB.
because at the back of the head. Yes, sorry, Dr. Chetan, sorry for cutting you off. Yes.
Yeah, yeah. Actually, TB was not on my head. Like I was thinking, it could be a
Mm.
pneumonia or it could be a something atypical pneumonia because
This is the
the
thing.
symptoms.
This is the thing that
Mhm.
that we have things at the back of the head. When we have things at the
Mhm.
back of the head, then we tend to forget the other things. We don't keep an open mind, right? Because I told you this person study 4, he's got a cough, you thought of pneumonia, right? You thought of pneumonia, but he had sputum, he had fever, right? You're also supposed to ask him anything apart from fever. Has he lost any appetite, right? We have to exclude the sinister things, right? We have to definitely ask in all the history taken, we definitely have to ask him about the fever, about the weight loss, about the loss of appetite, about the night sweats, because this can happen in younger and older, that we're trying to be a safe doctor, right? So to be a safe
Yeah,
doctor, we
yeah,
need to
yeah.
ask cancer. Otherwise, you did good, Dr. Chetan. That's as far as I know. I think you did good. I don't have the other people to give you review today. I don't think they're around, but as far as I'm concerned, you did awesome.
Okay. Thank you, doctor. Thank you so much for giving me the opportunity as well. Thank you.
Yeah, thank you so much. Anybody else who wants to do? We're going to do some more, and we'd be changing the scenario a bit. Anybody who's interested, we can do this. And at the end, any of you can be the doctor to help me, practice as well.
Yeah. Yeah. If you would like to practice, I can be a patient doctor.
Okay, let's just see if anybody else wants to be this. If not, then you can be the patient, right?
No worries. No worries. Yeah.
Okay. Anybody else wants to practice? We're going to change the scenario a little. Yes, Dr. Skipper. Is this Dr. Ahmed? Hi, Dr. Ahmed, how are you doing? Okay, don't say to the patient, you must be worried. I think so. Okay, right. No, you can say you must be worried because he is worried. I have a question. I noticed that this conversation is just like OET speaking. Is it so? It is almost like that, but it is not that, because in OET you have in speaking you do have a draft. Here you don't have a draft. So if you think it's OET speaking, it's not. Yes, we do have to have a lot of IPS. It's helpful, right? The empathy, it is helpful, but it is not OET. It's different because we have to be, keeping an open mind. We have to make sure that we ask them the right questions, be relevant, take the right kind of history, have the right kind of examination. It is almost like that, but it's not that, right? You see the difference between almost like that and not that. Dr. Skipper, do you want to practice? Anybody else who wants to practice? Because I want to do lots of scenarios.
I'll do one case.
Okay, all right, Dr. Anu.
Yeah.
All right, is that all right? Can
Yeah,
you
yeah.
hear me properly?
Yes, I can hear you properly.
Okay, so this person, let's just do this one, right? This person is 55, right? They're 55, and let's change their name. We can call them Ali, right? There can be a Muslim there, all right? So, or let's call them Raj, just for fun, because it's boring, right? So this person is 55, he's Raj, he's got cough, all right? He's got cough. This is just a scenario. He's got cough and he's in the respiratory department, right? Even though we're not very sure, but he's in the respiratory department, right? So this one's Raj and he's got cough and he is 55, he's in the respiratory department. Whenever you're ready, we can do this, right?
Okay. Okay, I'll start.
Okay, you want to start, right?
Yeah, I'll start. Okay, hello. I'm Dr. Anu. May I
No,
confirm
let me just start the timer for you, okay?
Okay.
Begin.
Okay, hello. I'm Dr. Anu. May I confirm your name and date of birth, please?
Yes, doctor, my name is Raj and I am 55 years old. I was born in 1998. No, 1989.
Okay,
yes, I forget that. Yes. Can you hear me, Dr. Anu? Dr. Anu, can you hear me? Dr. Anu, can you hear me? Can you guys hear me?
I can get you now. I can get you now.
Okay, all right. Let's start from the beginning, shall we?
Yeah, please.
Okay.
Begin.
Okay, hello. My name is Dr. Anu. May I confirm your name and date of birth, please?
Yes, doctor. My name is Raj, and I was born in 1989, 4th of May.
Okay, right. So may I know what brings you to the hospital today?
Well, doctor, I've been coughing blood, and it's not something that I wanted, but it's been a day, and I've been coughing blood again.
Oh, I understand. It must be very distressful for you.
Yes,
So,
doctor, it is stressful.
okay, can you tell me since when did it all start?
Well, doctor, it's been around 3 weeks now.
3 weeks. And
Yes.
when was the first time did you notice blood in your cuff?
Well, it's been there 2, 3 times, and it just happened again today. So I thought that I should come and seek help.
Okay, just today you saw it. It's good that you came here. And may I know what is the amount of blood present in your with your cuff? Is it like just blood when you cough out, or you have a sputum which is stained with this streak of blood, or you have clots? What is it? Does it look like exactly?
Well, doctor, it's like sputum, and there's some streak of blood along with it. But I can see more blood now. Nowadays it's more blood.
Okay, so since 3 weeks you are coughing and you are having sputum which is stained with blood, and the it is progressing um on the worse side. Am I right, doctor? Am I right, Mr. Raj?
Yes, doctor. Yes, doctor.
Okay. Is there anything else that's bothering you?
No, doctor, this is all that I was worried about. I'm very worried about it. I mean, seeing cough, seeing blood, it's something I didn't expect.
Hello?
Well, doctor, I'm just worried about this blood, nothing else. That's all I'm worried about.
Okay, Mr. Raj. I'll definitely take care of your blood coming out with your cough every time you cough. And may I know something more about your cough now?
Yes,
So when you
doctor.
cough, is there a specific time of the day when it is worst?
No, I cough all the time. Previously, it was on and off, but I cough all the time.
So is it worsened by any particular condition like cold or dust or pollen or anything else?
No, doctor.
Okay, is your cough painful?
No, doctor, but now that I'm coughing, it hurts my chest and I start to bleed. Like 3, 4 times it happened that I was coughing so bad that the blood came out with sputum.
Okay, I see that. It must be very distressful for you. And okay, you have chest pain also when you cough since it's
No,
been
doctor,
three
I don't have
weeks
chest
now.
pain. No,
You
I
don't
don't
have
have chest
you. Okay, I just thought you said I had. Okay, okay. I'm so sorry for this.
pain. All
And
right. No worries.
okay, do you have any breathing difficulty?
No, doctor, nothing like that.
And do you hear any sound when you breathe?
No, doctor.
Okay, okay. So do you? How is your appetite these days?
Well, I'm eating, but I don't like eating anymore, if that makes sense.
Okay, so have you lost any weight?
Not that I've noticed, not much. I've always been a thin person.
Okay, has anyone told you that your clothes seem loose now, or you are losing weight?
No, doctor, not really.
Okay, do you
I've
feel
always been,
tired?
a thin person. Oh yeah, I
Oh,
do feel tired. I feel tired like a lot these days. I feel really, really tired. And like when I just do simple activities, like when I'm even taking my dog for a walk, it's very difficult for me to, just do it. And I'm worried.
did you have similar problem before?
No, doctor, I did not.
Okay. Um, so now, do you have fever or running nose?
No, doctor.
Okay. Now, can you please tell me, have you been diagnosed of any medical condition in the past?
No, doctor. No.
No. Okay. So are you, have you ever been told that you are allergic to any kind of drug or food?
Yeah, I'm allergic to. Yes, doctor, I'm allergic to peanuts.
Okay, right. I'll note it down. And so, is anyone in your family or in your contact suffering from any similar problem?
No, doctor, nobody.
Okay, okay. So now I'll ask you questions about your general lifestyle. Uh,
Hmm.
what kind are you taking healthy diet?
Yeah, doctor, I eat healthy.
Okay. Do you exercise?
No, I don't like to exercise.
Okay. Do you smoke?
Yeah, I do smoke.
Okay. How much are you? How many cigarettes are you smoking?
Well, doctor, at the moment, I've been smoking around 20 to 15 cigarettes.
2
Okay.
minutes remaining.
So have you ever thought of quitting smoking?
Well, doctor, I did think about it, but it's very difficult. It's really, really difficult for me to quit smoking.
Okay. In case you ever think about quitting smoking, you can talk. You can come back and talk to us regarding that. And
Okay, doctor, I do.
now, I'll ask you some questions which we usually ask everyone. Do you take recreational drugs?
No, doctor, I do not.
Okay, okay. So, Mr. Raj, may I know what do you do for a living?
Doctor, I am a banker. I'm a banker.
Okay. And have you ever been exposed to asbestos?
No, doctor, I haven't. No, I'm a banker. I've never been near any industries, etc. So no, not really.
Okay. So, I would like to examine you and check your vitals and examine your chest and listen to your heart and lung sounds, if that is okay with you.
Yes, doctor, please do.
Okay, and I will also do some initial investigations on your blood, and we also need your chest X-ray.
Okay,
Can I
doctor.
have the finding? Can I have the finding?
Yes, he has an opacity in the chest, right in the middle, and in the blood CP, you can see that he has a little bit of anemia.
He has a little bit of. I couldn't
Anemia,
get that.
anemia,
Anemia.
anemia.
Okay.
Yes,
So he has opacity in the chest, and he is anemic, right?
yes.
Okay, and he's smoker since 22 years, and it is not related to. Okay.
Never talk to the
Uh,
examiner.
No,
Okay.
I because I actually sometimes your sound misses, and I'm just confirming whatever you say.
Okay. Yes, doctor. I'm
Okay.
just kidding. I'm just kidding. All right.
Yeah. I was just making sure. So,
Okay.
do you have any idea what you might be going through, Mr. Raj?
Doctor, I have no idea, but I'm very worried about this blood coming in, and I just don't want this to happen again. I just don't want this to happen.
Do you have any concerns?
Yeah, I just don't want this blood to come again.
Okay. So, I don't know. Can I have more findings like from auscultation? What do we get? It's just or from percussion?
You did not. Did you do the chest examination? Doctor, I know the time's up, by the way.
Okay.
Did you specifically ask for chest examination?
Yes, I said I'll examine your
I'm
chest,
sorry, I
listen to
couldn't
your
hear
heart
you, but
sounds and lungs. Yeah.
if you had said that, definitely, there is this decreased breathing on the right side, and there's fullness on the supraclavicular area. The person's got clubbing and nicotine stains, if you would have asked that. Right. So, what's your diagnosis, Dr. Anu?
Looks like CA lung to me.
Yeah, it is CA lung.
Yeah, looks like CA lung, and I was actually differentiating between maybe bronchiectasis, but then
Mhm.
you said that there is no specific time of the day when the patient has cough. Then
Mhm.
he had no fever and there was no contact history with any person who had any kind of infection. So tuberculosis and this tuberculosis was ruled out. Even pneumonia was ruled out. There was no fever. Then he was anemic. Yes, looked like something like towards CA. Then he had
Mhm.
weight loss, history of weight loss. He was not taking proper diet now, and so
But you know,
everything was pointing.
the thing is that there are some people, like for example, I mean, it's not going to be like that. This is make believe, but you're very right. He had CA lung, and the thing is that there are some people who are genetically their build is so that they're always thin, right? So even then you could exclude it by saying that that have you lost, are you having any tiredness, and he did say he was having tiredness. Then you can ask
Yes,
for
he said
night
he. Yeah,
sweats, right? Yeah, you could
yeah,
ask for
yeah,
night
yeah.
sweats to exclude TB, because in this scenario this could be bronchiectasis, right? But this could
Yes,
be related to that. This could be almost both the things. It could be bronchiectasis, it could be CA lung, it could be pulmonary embolism. It was very important to rule out pulmonary
yes. I
embolism.
could have asked about. Yes, yes, about pain in legs. I could have
That's the
asked about,
first
but then
thing.
yeah,
Mm.
but there was no chest pain in this patient. There was no chest pain, and
Yeah.
I thought about asking about night sweats, but then I just thought maybe not tuberculosis. I don't know. Somehow I just thought, and it just left my
That's all
mind.
right.
So
Dr. Anu,
yeah,
we're still practicing, right? We all are just practicing
yeah,
together.
yeah,
Nothing to worry about.
yeah, yeah. But
Okay,
thank you
that's all
so
right.
much.
That's all right.
Yeah.
No worries. Dr. Anu, I think that, you missed two things. First thing is pulmonary embolism, right? You want to rule that out. And then I guess you did ask about the psychosocial. Did you ask about the psychosocial?
No, I didn't
Like,
ask
is he
about
stressed at
psychosocial.
work? That's really important. Like, because he's having cough or something which has been there for more than a three weeks time, right? So we need to ask
Yeah, maybe.
psychosocial.
Yeah, yeah. I
Hmm.
asked if anybody around you is having same symptoms.
Yeah, but psychosocial also includes, stress, because we're also going to deal with his emotional problems, right? So stress, are you
Okay.
stressed? Are you working better? Is this affecting your lifestyle, right? Because if we know that the person's lifestyle is being affected, then, we can come and think of sinister problems more. Because, acute conditions, right? Like, for example, if you're thinking pneumonia, that's an acute condition, almost an acute condition. It wouldn't affect his lifestyle as much as something else, right? Pulmonary embolism,
Right.
carcinoma, tuberculosis, they would affect his lifestyle, right? A little they'd affect his
Right.
lifestyle.
Right.
Also, you ask about the bleeding disorders, right? Or if he's using any blood thinners, because he's 55, right? He's
Yes.
55.
Yes. Yes. That is
I
very
did say
important.
that I
Right.
don't have
Right. Right.
anything else, but try and do exclude, the blood thinners. Apart from that, your history was very good, right? And you did specifically, ask them whether it was, blood streaked in the sputum or if it was frank hemoptysis, right? And and apart from that, do ask about dizziness, drowsiness, right? Number of times he's lost blood, right? And apart from that, when he did say that he was coughing, right? He did say that he had cough. So you went ahead and you didn't ask when the cough started. That's where the main thing happened. Because I did say that I've had blood and it's been there like for this 3 weeks time. But if you had asked me that when you had cough, I would have said that a long time ago, like 3 months, right? So it could have been a
Okay.
chronic case. That's one thing, right? And like when you started this station, you started by saying I understand. Don't say that word, I understand, right? When it comes to the
Okay.
IPS for these cases, don't say I understand. Instead, we could say I see, right? Because
Okay.
even
Okay.
though we've been told that that we should be there and say we understand, but in reality, for you to understand something or for me to understand something, I should be going through that. No, so it's better to say
Okay.
I see, right? We're putting ourselves on the safer side because these people, they are more chalak than we are. I don't know if you know the word chalak. Like they're intelligent,
Yeah.
right?
Yeah.
They're
Yeah.
intelligent, right? So, and when
Right.
you assume, so it was good that when you assumed, you did say, you did apologize, right? Like I did say, I don't have chest pain, right? And you tried to exclude asthma. That was good. And when he said that I'm worried about this bleeding, right? So we can gain marks by being more empathetic, right? You just went on. Do listen to the patient, even though we're trying to work up with
Okay.
the diagnosis and we want to come to the diagnosis, right? But we're junior doctors, right? In 8 minutes, it's kind of difficult for us to come up with the diagnosis, even though we're supposed to. We can give them the differentials, right? right? We can give them the differentials that that because you said this and this could happen, that could happen, right? Like with the symptoms that he had, right? For example, that he said that I've got chest pain and I'm having this. For example, he said that I'm having cough and I've seen on the lungs that you have this opacity, right? It could be that you might have lung cancer. It could be pleural effusion, but we're going to make sure and we're going to refer you, right? What I'm trying to get to here is that be safe, doctor, right? Exclude the sinister things. And secondly, we need to make sure that, we're being empathetic. Active listening is really, really important, right? And when you said that, do you eat healthy? Now, we need to ask them, what does it mean by healthy, right? Because in different cultures, healthy means different things, right? In Somalia, right, eating healthy is just having a piece of bread, right? If this person is a Jew, then eating healthy means having ham, right? So make sure you understand what it means by healthy. For most of the people, being healthy is also like eating fast food, etc. What does it mean by being healthy, right? What does it mean by these are vague terms, so do explore them, right? And along with that, we can also ask for petechia. I don't think you asked a family history. That's it. That is it.
Yes,
That is
yes,
it.
yes. Yeah, this was the first time I'm doing in a group actually, but and thank you so much. And I'm
No
happy.
worries.
I'm glad
You've
I
been
did.
practicing, right? I've not even been practicing, but I'm here to judge.
Thank you
Okay.
so much, Dr. Hafsa. Thank you.
Anybody else who wants to practice? Because if not, then we're gonna do one more, and then I'd want to practice.
Yeah, I can do this if you don't mind.
Yes, Dr. How are you doing?
I'm great, thank you.
That is awesome. So let's just do one for you. Give me a second. I'll just find what I want to do. All right? Okay.
Okay,
Yeah.
take your time.
Yes, Dr. Ba, we can start.
Yes, same station, right? Cough.
Yeah, this
Raj.
person, Raj, I mean, he's in the respiratory clinic. Let's just change his age just a little, right? Just a little. Let's make him a little younger. Okay?
Okay, 35, Raj, cough. And I'm in the respiratory department.
Yes. Okay. No, he's not having cough. Let's just change it. He's having shortness of breath. Okay?
Okay, Raj,
you ready?
35, shortness of breath, and I'm in the hospital. Okay.
You are in the respiratory department like you're in the hospital, right?
Yes. Okay, let's start. 1, 2, 3.
Okay. Bismillah. All right.
Okay, Bismillah. Hello, I'm Dr. Ben Hamida, one of the junior doctors in the clinic today. May I confirm your full name and age, please?
Yes, doctor, my name is Raj Kumar and I am 35 years old.
35. Okay, is it okay to call you Raj?
Oh, you can call me Mr. Kumar.
Mr. Kumar, yes. So what can I do for you today?
Well, doctor, I've been, for the past 3 weeks, I was having this shock. I couldn't just catch my breath, but just this morning, I was going on a walk and I couldn't catch my breath, and I thought that I should come and see.
Just to quickly summarize from what you've said, I think like you've been having difficulty in breathing for the last 3 weeks.
Yes, doctor.
Are you?
Sorry, last 3 days. Sorry, last 3 days. I'm going to rephrase. Last 3 days.
Okay,
Yes,
and how do you feel? How do you feel at the moment? Are you like comfortable to talk?
Well, I think I'm all right, but it's very difficult for me to catch my breath. I mean, I can continue, but still,
Yes,
a little
yes.
bit.
Well, Mr. Kumar, can you tell me in brief a little bit more about this difficulty in breathing?
Well, doctor, I was walking in the morning, and it was kind of very cold, and I started, I started coughing, and then I couldn't catch my breath, and I thought that I should come and seek help from you, because I spoke to my GP and it wasn't around, so I just came here.
Okay, well, this is a good thing for you to come early. Okay, so I would just like to go through a couple of things to assist your symptoms in a better way. Okay, so Mr. Kumar, you've mentioned that you've been having difficulty in breathing when you had a walk. Can you tell me, like, do you feel like when you do any sort of exertion, this difficulty in breathing increases?
No, doctor. No, doctor.
What about at rest? Do you feel like out of breath also at rest?
Yes, doctor. Sometimes, sometimes it gets better, but it is now getting a little worse. And I also have some tightness of chest. Like it feels like something's around it. So that's what's worrying me. But more than that, I'm worried about this this shortness of breath, and that's what I'm worried about.
I see. Okay, so we will come to the tightness in a bit, but you also mentioned a cough. Can you tell me, like, is it like this? You've been coughing within the past 3 days?
No, doctor, I don't have cough.
Okay. Okay, and about the tightness, like, is it like, like you're feeling like your chest is tightened, or is it like pain?
No, it's like, something's around it. It's not pain. It just feels like, like I cannot breathe. And, it's tight. It's very tight. My chest doesn't open up.
What about any wheeze?
Yeah, I do. I can hear the whistling sound.
And have you ever had like similar symptoms before, or this is the first time?
When I come to think of it, when I was 4 years old, I used to have a cat, and that's when I had it. But it got better because my cat died, and since then I've never had this.
Yeah, well, first, I'm sorry about your cat, but coming back to your symptoms, can you tell me, like, apart from what you've mentioned, is there anything else?
No, doctor, this is all that I'm worried about, because I don't know, like, why it starts in the morning, and sometimes when I take my blood pressure medication, it just happens. But I've recently started that medication. It's been around a week. I was diagnosed with high blood pressure, so that's also something which.
Okay, so do you know, like, what the medication is?
I don't know. It goes by the name of propinolol something. I'm not very sure.
Oh, okay. And apart from high blood pressure, is there anything else?
No, doctor.
And about, from the medication, do you take any other medications or over the counter?
No, doctor. Nothing.
Good. Okay, so I would just like to get a better understanding from the symptoms you've mentioned. May I ask, like, if you had any fever recently?
No, doctor.
Any
Not that
unexpected?
I've noticed, but it sometimes happens with the flu.
Like, do you mean like sore throats and feverish?
No, when I have this wheezing, at times I've noticed that I do have the fever.
When was it? When was that?
Just yesterday.
Okay. What about like any unexpected weight loss recently?
No, doctor, nothing like that.
Any lumps or bumps?
No, doctor.
Okay, that's good. Okay, so if I may ask, Mr. Kumar, like, have you given any thoughts what might be, the cause of your symptoms?
Well, doctor, I don't know. As you know, we were talking. I think it might be the same thing that happened to me when I was a child. I'm not very sure what that was because I never got to the hospital. It got better on my.
Yes. Okay, and like you have.
So it got better.
I see. And do you have any worries? Anything in particular concerns you today?
No, doctor. I just want to get better. I don't want to feel the way I'm feeling.
Definitely, we will help you with that. But for now, is it okay to examine you? Mr. Kumar?
Yes, doctor. Yes, doctor.
Yeah, I would like to check your observation by taking your blood pressure and temperature. And after that, I would like to examine and listen to your chest and your heart.
Mhm. Okay, so
Okay.
he's got wheezing, and
Yeah.
his oxygen saturation is kind of low, right? It's in
Okay.
the 90s, right? 94s, and he's got wheezing. Apart from that, everything else is kind of normal.
Okay. Okay. Well, Mr. Kumar, thank you very much for letting me examine you. But from my examination, I found that your oxygen is a bit low, and also there's a wheeze sound in your chest. And from the symptoms you've mentioned, I kind of like suspect it could be something related to your lungs, a condition called asthma.
All
Have you
right.
ever like
Yes,
given any
doctor.
thought about it before?
Yes, doctor. My mother, she had this when she was a
Hmm.
child. She did have that. So I don't know if it's passed on to me, but what are we going to do right now?
Well, yes. First, since we need to first, confirm this. Would like to, talk to my senior. We might need to run a couple of blood investigations, and as we might do a special test. It's like a device you will have to blow, and
Mhm.
so we can, confirm the diagnosis of asthma. How's that sound?
Mhm. All right, doctor. As long as I get better, I'm up for it.
Yes. Well, since your oxygen is low, I don't know what happened.
No, no, no. Take a minute. Take a minute. Go ahead. Go ahead. You still have a minute.
Yeah,
Go
well,
ahead.
Mr. Kumar, since your oxygen is low, so I would like you to put you on oxygen, okay, just to help you breathing a little bit. And
Mhm.
once we confirm the diagnosis, then we have to talk about how to relieve your symptoms and prevent it from happening again. What do you think about that?
Well, doctor, that sounds good.
Yes. Well, I have a couple of
Go ahead. Go ahead. Go ahead. Go ahead. Forget about this.
well,
Go ahead.
we have a couple of things we can do, Mr. Kumar. Things from our side, and there are like things you can do from your own side. Which one would you like me to start with first?
Well, the things that you can do, doctor.
Yes. Well, once we confirm the diagnosis, we can prescribe you some inhalers. We have two types of these inhalers: the blue inhalers and the brown inhalers. The blue inhalers, you will have to keep it with you at all times, and whenever like you had any difficulty in breathing or wheezy chest, just take a couple of puffs to relieve your symptoms. Okay.
All right,
And
doctor. Okay.
the other one, we call it the preventer. It's a steroid inhaler, which will decrease the inflammation in your chest, so that you can breathe in a better way and prevent future attacks. Okay.
All right, doctor. Okay.
Okay.
So do you
So,
think I'm going to get better?
sorry.
Do you think I'm going to get better?
Most definitely, Mr. Kumar. But there are things we have to talk about. Like some triggers that might trigger your symptoms. Things like if you had a pet at home, or you need also to make sure that your home is well ventilated, clean from dust. And as well as at winter time, you need to protect yourself from the cold, so that you don't have another attack. Okay.
Okay, doctor. All right.
Thank you. I'm exhausted.
All right, Dr. Baha. No, 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 no. You did good. You did good. So, what's the diagnosis?
Asthma, bronchial asthma.
Yeah, it is. Yeah, it is. But you didn't
Oh, I
ask the
know.
routine things.
I actually did know it from the beginning, but I was like, what's going on? Like, I feel like I've lost a lot of
Yeah.
time. What am I doing?
Yes. That's the thing. We don't have to think about the time.
Mm-hmm.
Because when we think about the time, this is human nature, right? When you think about the time, you lose time, right? Don't think about the time, just keep going, right? Even when you hear the bell, they have said that you need to be calm. You need to make sure that you're listening to the patient. You need to make sure that you're being a safe doctor, because in reality 8 minutes is not enough, right? However, you did everything right, you did the management right, you were saying that I'm going to involve my senior. I think you did say that, right? But you
Yeah.
forgot that let's start from the beginning though, that, when the patient started saying that he's got 2 things, then you said, let me summarize. No, you don't need to summarize then. You started by saying, let me summarize. No, if he said like 2 things, there's nothing to summarize. You just started, right?
Do you
So
actually, yes, actually, do you know I do this? I do this sometimes, to reassess my mind for the next question. So I'm summarizing, and in the same time, I'm
Instead of
thinking
using
about what.
You're very right. But instead of using the word summarize, how about you say that, so let me just confirm, right? Or just to confirm, right? Just to confirm. Instead of using the word summarize, how about you say just to confirm? Even though it's not an English exam, but it'll give a good impression that you understand things, right? You're not summarizing. Like summarizing means you're ending the thing, right? Like when you're done with the presenting complaint, which was not the case, right? And I guess you did ask about the flu, the fever, but like when you, in the back of the head, I was very sure that you know the diagnosis, right? That
Yeah,
person's
but
got asthma.
I totally forgot about the triggers, the eczema, the family history.
That's the thing. That's the thing, right? Because and even if you forget that, that's all right. Even if you forget that, don't need to go on, right? You don't need to go on and exclude the things, because that is relevant history taken, right? That you need to ask the relevant questions, right? And if you've forgotten it, then you should be maybe asking about the flaws, the ice, and they'll help you out, right? That's what we've been learning from Dr. Mo. I think you've also taken this course, right? So allergies.
Yes.
Just one thing that you did was that you did not ask about allergies, right? The 5 Ps that we have, that any pets, any pollens, any perfumes. That's the only thing I think that you forgot. Apart from that, it was all good. And in the management, I think you forgot about the investigations that the person would be doing in the future, and also the referral.
In the future, investigation in the future. Sorry, investigations in the future, like what?
Investigations when he's going to go to the the specialist, what they'd be doing, right? What we are going to do more, right? You did say the PFR. We could say that we're also going to go for some chest X-ray, right? You did say about the PFR. You're gonna also talk about the chest X-ray, just to exclude the other things, right? Because we're not so sure. Because if you did not ask the triggers, you're not very sure if he has asthma. How can we directly say that you're going to go for PFR? Because this is just based on what you did, right? And coming back to the GP, yes, doctor.
Let's say, sorry for interruption. I'm in the respiratory department, so I will not admit this patient, but what should I do? Like refer, or I'm already in the hospital? Like, how can I refer a patient when I'm already in the hospital?
No referrals. I'm sorry, I take that back. You're very right. I forgot.
Yeah, so should I admit him here? He's not, that severe.
You see, the patient's got a low oxygen, right? If he's got a low oxygen, maybe you're going to admit him for a while just to see he gets better. Even though he's in the respiratory, he has shortness of breath, right? He's got chest tightness, and it started in the morning, right? One thing we could have done is that, like, if we're thinking logically, because they do say in the GMC error file, and I've been following it kind of religiously. I don't know why. That just gives a gist of everything. They say use logic, right? So if the person said that started this morning, we could say, what were you doing that it started in the morning, right? Like if we are trying to open it up, like logic would say that we ask him, what were you doing? Even though I'm here and you're doing the exam, so it just you kind of forget, but we're here to help each other out. So how about we keep it open and just ask him, what were you doing, right? So apart from that, you did good. The management was good. You spoke about the blue inhaler, the brown inhaler, and the so that was good, Dr. Ba. Don't be worried. Just when you have a diagnosis in the head, yes.
One last thing. One last thing, doctor. What's your advice on whenever the 6-minute bell rings and I didn't didn't finish my whole history? Should I stop and move on to the?
Be calm, right? If you have the diagnosis at 6 minutes, right, go to the examination, do it, right? Just verbalize it. Yeah. Like if you're done with the relevant history that you wanted to take, because they're not going to give us marks for asking the questions. The marks are for what does it say? Data gathering, right? It says data gathering. You've got 4 marks for that. As far as I'm concerned, we're also going to ask it from Dr. Mo, right? Because I'm also learning. But what I think is that the whole scenario is that they're asking if data gathering, right? So data gathering just doesn't have history. It has got your examination, right? What if the examiner gives us a clue that this person's got this and this and this, right? We don't get marks for asking questions. We get marks for gathering the data. Definitely history is important, presenting complaint is important. And if we are, going to examination good, we need to do that, right? We'd be just verbalizing it. Maybe it'll take half a minute, right? Because we're going to say that, I'm going to do, if you allow me, if it's okay with you, it's going to take half a minute, right? Even if we use a timer, right? We're going to say, if you allow me, I'm going to do your top to toe examination, journal physical examination. Apart from that, I'll be taking your vitals, which would include the pulse, the heart rate, the pulse, the blood pressure, and, temperature. And I'll also be checking your chest. I'll be doing auscultation, palpation, percussion, and inspection, right? And then we'd wait for, and meanwhile, I'd also be running some blood tests. It'll just take only half a minute. If we just, do practice a lot, I guess it's going to take half a minute. I'm saying lots of things. This is difficult, but, advising is easier than doing things. So just you asked for advice, right? And I'm not saying it on my own because you asked for it, right? So, I mean, we could just take half a minute, right? Then we can calmly tell them, instead of, we could just skip the idea thingy here, and we could just say that, based on what you told me, and you had this and this and this, so I think you have this. We have, our provisional diagnosis, then we can move to the management, because we still have, 1.5 minutes, right? We still have half a minute or a minute. We can still come to the management bit, right? Overall, I guess your IPS is really, really good. That's your saver, IPS, history taken, because, we need to think about the distribution of marks. As Dr. Mo says, that, 4 minutes, 4 to 5 minutes, we're supposed to stop history. And that we can do is when we know actually what the diagnosis is. Because, you said yourself, because I was very sure that, you know the diagnosis. I think you were aware of it, weren't you?
I were what?
You were aware of the diagnosis, right? Like you were asking questions. Yeah,
I kind of know. I know that from the start, but I was there. I just don't know what happened. That's it.
Yeah, so just that's all right. That's all right. What I'm trying to say here is that if we are coming to the diagnosis, because we're not very sure, we're junior doctors, we can't just say that you have asthma. We're going to give them some DDs, right? But just to exclude things, maybe we can ask 3-4 questions out of ask about the past medical history, and move on, right? Let's not be hung up if we know the diagnosis by what they've said, right? Yes, we're going to exclude things. So that's what I think, Dr. Baha. I'm talking a lot, but I'm trying to learn and trying to, say things that I know.
Thank you very much.
No worries.
Thank you very much.
No worries. Anybody else wants to contribute to what just happened? Or anybody else wants to practice? Because if not, then I'd want to practice, and any of you can be the patient. And you guys can judge.
I can practice if it's possible.
Yeah, definitely, Dr. Atta, is it right?
Yeah.
Okay, all right, Dr. Atta. Anybody wants to be the patient? Because you guys might have another scenario in your head. If not, then I can do it. Okay. All right, Dr. Atta, whenever you're ready, we can start.
So is it the same station?
Yeah, the person's 35 and they're having shortness of breath. And you are in the accident and emergency. Okay, we can change their name. What name would you want your patient to have, Dr. Atta?
Anything, doesn't matter. Alex, for example.
All right. I know it doesn't matter, but we're bored, aren't we?
Yeah.
Okay, Alex, your patient's name is Alex. He's in the accident and emergency and they're 35 years old.
Okay, I can start.
Whenever you're ready.
Hello, I'm Dr. Wanata, one of the doctors here in the A&E. May I confirm your name and date of birth, please?
Yes, doctor. My name is Alex, and I was born in 1971.
Okay. How can I help you, Alex?
Well, doctor, the thing is that, I was going and I was on the road, I was on my bike, and, I just hit a lamppost, and since then I'm having shortness of breath.
I'm sorry, you got what?
Can we do this again from the beginning?
Okay, no problem. Yes.
Okay, can you hear me properly, Dr. Alex? Dr. Atta?
Yeah, now I can hear you. I just didn't hear the word that you said before,
Okay,
shortness of breath.
all right. Okay, all right, let's start.
Hello, I'm Dr. Wanata, one of the doctors here in the A&E. May I confirm your name and date of birth, please?
Yes, doctor, my name is Alex and I was born in March of 1989.
Okay, so how can I help you today, Alex?
Well, doctor, I'm having shortness of breath. It's very difficult for me to breathe. I was just on my bike and since then, I just hit a lamppost and since then I'm having this shortness of breath and it's very difficult for me to catch my breath.
Okay, I'm sorry for the experience that you had. Could you tell me when did this happen exactly?
Well, doctor, just an hour ago and it's very difficult for me to even talk.
Okay, so would you like me to give you oxygen now so that you're able to talk?
Yes, doctor, I think that'll be good.
Okay, so this is a cement station. I don't know. So,
Let's just continue.
I'll be measuring your oxygen saturation. I'll be giving you an oxygen mask, oxygen to the oxygen mask, and so that we can go on and know the whole history from you, so that I'm in a better situation to address your concerns and be able to help you.
Okay, doctor. All right.
Okay, so
Okay.
I'm assuming that I gave him an oxygen. Okay.
Dr.
So how do you feel now? Do you feel better?
Ask yourself, let's just stop. We're going to do this from the beginning, but you ask yourself that should I give you oxygen? If you give, if you ask them, they're going to say yes. What if they say yes? Right? How about we say that, all right, I can see you're in distress, but are you comfortable enough to talk? Can we just have a little chat and then we'll be, trying and helping you. Right? Because if this was definitely cement, then then definitely they'll be having all the equipments and we can definitely give them oxygen. Right? That's the same thing that GMC says, that if you offer them, the examiner might say yes. Right? So it's all about the offerings, I think.
You mean that they can say that I say yes for what? Yes for continuing the conversation, or yes for the oxygen?
Yes for the oxygen. They can say that.
Yeah, okay, and then how should I proceed? When they say yes,
then
what
you
should I do? Like,
here,
should I call them?
Don't ask them. See, if he was having lots of problem, right, then he would not be here to talk, right? Or, first they would definitely, if this is such a serious patient, he would, he would not be talking, right? Once you're done with the examination, that's when, we'd be getting the saturations, etc. And then, we can, just say that, I'm going to put you on oxygen, etc. But because this is not SIM-men, right? We're just doing history taking right now. So let's just keep it that way and not ask them that, do you need oxygen? How about we say that, are you comfortable enough to talk? Can we have a little chat? And then we'd try and help you, because maybe the patient would be saying yes. If you offer oxygen, then the patient might say yes. That's what I'm just trying to work.
So this is a problem, you mean? If he said yes, it's a problem?
Yeah, that's what I'm saying.
Oh, okay.
But we're gonna ask our teachers. We're just doing things here and I'm just learning myself as well. But we can ask Dr. Ba or anyone else that, what if the patient said yes? And if there's a way we can tackle it.
Okay.
Are you guys understanding what I'm saying? Dr. Atta, are you still there? Are you angry?
Yeah, I'm here. I can hear you. Yes. I'm just
You're
waiting
not
for
angry,
others
right?
to respond.
You're not angry, right?
No, I'm not angry. Of course
Okay.
not, doctor. No.
Yes, Dr. Ba, are you still there? Because we are practicing, right? I'm not a teacher, not now.
Yeah,
right?
I'm here.
No, but I'm actually glad that you brought this station, so that it's challenging me now. So
yeah, because we are practicing, we are doing things and we are learning online from different academies, but we're not yet practicing with anyone in the UK. I'm not really sure if you guys are. I'm not. So these are questions that I think we should be addressing. Dr. Baha, what do you think? Should we be offering them oxygen?
Well, I think because I've never done the exam, but I think it depends on the patient in front of you. So I don't think they will bring someone who's out of breath and cannot talk. That will be some man. But as a part of IBS, I can just ask him if he's comfortable to continue talking.
Right, like we shouldn't offer them. Is that what you're trying to say? Because when I don't know if you're in the group,
Yeah,
but when I was
actually-
asking,
Sorry, actually, personally, I don't prefer to put myself in a situation where I don't know what to do. Like if I offered him something and he said yes, and what should I do next? Should I pretend I gave him?
because
There will
they
be
do say
like
specifically.
yes. So
But-
painkillers, for example, I will be asking about allergy, and I will waste my time, and my structure will blow out.
Lose the form,
so
right?
yeah, so I think just to show some IBS, just ask him, is he comfortable to continue talk? Whether therefore
The problem here is that you said I'm not comfortable to talk, so that's why I said do you want me to offer you oxygen? I didn't know what to say because you said I'm not comfortable to talk. So I didn't know.
This is another story. Yeah, this is another
So
story.
so for example, we're not pretending, right? And we've got the bad kind of a patient, and they are giving us a tough station, right? Because we're gonna have tough stations. And he said that I'm not comfortable to talk, right? So we can just say maybe we can, just to save time, as Dr. Baha said, that we don't want to lose our structure and we don't want to put ourselves in a situation if this is history taken for sure, because on this station it does say take history and manage, right? It doesn't say there is a SIMMAN or something, right? And so if that's the situation, maybe what we can do is we can just say that all right, I know that you're in distress. How about we have a little chat, and then we can help you in breathing better, right? Just to save ourselves and also save the IPS and save the time. That's what I'm thinking. I'm very worried about these kind of situations, so I'm trying
That's
to bring
actually a very good reply. You said, can you say it again? Can we?
Yeah, like I can say that, I know you're distressed and it is difficult for you, but I really want to help you. And how about we have a little chat, and then we'll help you in breathing better. We do something to help you breathe better.
Yeah, that's really good. Yes.
Right. So Dr. Atta, can we do this from the beginning?
Yeah, okay.
Okay. Dr. Baha, do you want to be the patient?
Yeah, sure. Yeah.
Okay.
Let me just pick a station. Any respiratory.
How about I text you the station?
Sorry. How about?
I text you the station.
Okay.
Right. So you're just gonna receive it here.
In the comment section.
Yes. Have you got it?
Yes.
Okay.
Oh, I think I'm not comfortable to talk here. I need oxygen.
Okay. All right. Okay. All right, Dr. Baha. Whenever you're ready.
Yeah, I'm ready. Yeah.
Okay, Dr. Atta, are you ready?
Yeah, I'm ready.
Okay. So let's start. Let's begin.
Hello, I'm Dr. Atta, one of the doctors here in the A&E. May I confirm your name and date of birth, please?
Yeah, doctor. My name is Alec Thompson, doctor. I'm 25.
Okay, so is it okay to call you Alex?
Yeah. Call me whatever you want, doctor. I cannot breathe.
Okay, I can see that you're in distress. But could we have a little chat first in order to be able to help you in a better way? Be able to help
doctor.
you to.
Yeah, okay. But please make it fast, doctor.
Yes. Okay, so tell me what happened? Why are you unable to breathe?
Yeah, I don't know what happened, doctor. I was riding my motorcycle, and I had an accident like in half an hour ago.
Oh.
My
Okay.
friend.
I'm sorry for that.
Yeah, my friends brought me to the hospital, and I feel like I'm out of breath.
Okay. I'm really sorry for the whole experience. So, Anything else? So this shortness of breath, is it increasing from the time it started?
Yeah, I feel like, you know, my breathing is getting worse, doctor. Yeah.
Okay. So is there anything else along with that?
Like what, doctor?
Cough? Any cough?
No cough, no.
Any chest pain?
Yeah, actually, I have like my right side, doctor. I feel like there's some sort of pain whenever I touch my ribs, you know.
Okay. And this started also along with the shortness of breath.
Yeah.
Okay. Is there any fever? Flu-like symptoms recently?
I don't know, doctor. No, I'm not feverish. No.
Okay. So you were completely fine before this accident, right? You didn't have any problem with your breathing and your chest.
No, I was completely fine, doctor.
Okay. Has this happened to you before?
No.
Okay. So any have you been diagnosed with any medical conditions in the past?
No, doctor.
All right. Any weight loss, unintentional weight loss?
No.
Okay. Any lumps or bumps in your body?
No, doctor.
Okay. Anything else you are concerned about today?
Yeah, I don't know, doctor. Just, you know, maybe you can give me some oxygen.
So do you have any idea if this or whatever? خلاص ولا حاجة nothing. Okay. So thank you for bearing with me. I would like to examine you now. Okay, I will start by checking your observations, and I will do a general physical examination and examine your chest. Okay, I will listen and look and feel your chest. Okay.
Yes. Okay. Examination. There's like bruises on the right side of the chest wall, and X-ray shows jet black. Sorry, didn't mention X-ray, but X-ray jet black.
Oh yeah. Okay. Yeah, I wanted to mention jet black. Okay, so this is, I think, like maybe hemothorax or
I don't know.
Yeah. Okay. All right. And observations are normal. Okay. Thank you, Alex, for letting me examine you. Okay. Well, from the having listened to you and examined you, I'm suspecting that you the shortness of breath that you are experiencing and the chest pain also due to the trauma that you had, the accident that you had an hour ago.
Am I going to die, doctor?
Well, I'm sorry for the way you're feeling, but we will be trying to help you now as soon as we can. And we have a very good medical team here in the hospital that will be able to help you. Right? Okay. So now I will start fast to oxygen saturation. By the way, what was it?
Oxygen. Let's say it's a little bit low.
Okay. So I will start by giving you oxygen. Okay, to help you with the breathing through the oxygen mask.
Okay.
And what about blood pressure? Is he hypertensive?
Sorry?
Is there any hypotension? Is he hypertensive or something? So should I give him
No. Normal vital signs, oxygen low. That's it.
Okay. Well, yeah. I will be doing also some. Okay. So I would like to keep you here in the hospital for a while. Okay, but admitted here for a while. Do you have any problems with that?
No, whatever you want, doctor. Just, you know, just help me out.
Okay. Right now we'll be starting you on the oxygen. Okay. Involving my senior here in the management plan. He's chest specialist. He might ask for more further investigations, more sophisticated imaging of your chest, and we would be doing. I would like to send some blood tests. Okay. To make sure that you're not like bleeding from anywhere else, or there's any abnormalities with your blood. Okay. And by the way, are you allergic to anything?
No, I'm not allergic to anything, doctor.
Are you on any medications?
No.
Okay. So do you have any questions for me so far?
Like what the specialist will do to me, doctor, apart from the imaging, doctor?
Yeah, okay. We will be inserting so the short, as I told you, that you're feeling is due to the trauma, okay, and there's accumulation of fluid in your lungs, and it's causing you the difficulty in the air exchange inside the lungs, so you feel like you're not able to breathe normally. So we will be like, as an emergency plan, we would be doing an emergency treatment. I mean, we'll be inserting a chest tube to drain the fluid that's accumulated inside your lung, so that your lungs can expand and as normal and like function as normal without any like fluid accumulating in it.
Okay, doctor. Okay.
The specialist will just be here in order to reassess your condition, make sure that there is nothing that I missed that will be missing out, and like make sure that you're safe and there's nothing like else going on with you.
Okay, doctor, whatever you say, doctor.
Okay.
Okay.
Okay, thank you.
Thank you very much, doctor.
Yes, Dr. Bhai,
Like
comment.
the first time I see this station, to be honest. I don't know if it exists.
No, I
All
think
right.
her data gathering was okay. She forgot couple of questions about the allergy and medications, but I think Dr. Rawan, like in the management, you were like talking more than the patient. What do you think?
I was not organized as صراحة يعني the main problem was not
No,
that
apart from being organized, just when you give the management, try to break it down to a couple of points, and every point you need to check the patient. For example, I would like to do a couple of investigations. We might need to do an X-ray. So how does that sound? I'm also going to involve we might need to do a procedure to evacuate the air. What do you think? So, I mean,
so this is pneumothorax or hemothorax? I don't know. What is it?
It's a pneumo.
Why not hemothorax?
No, because could be. It depends on
the black air jet in the lungs is usually pneumothorax, to be honest.
Yes, it's a pneumothorax station, doctor. Right.
Okay.
So my only point here is try to involve the patient. Don't just say we will do this and this and this and that and this. So maybe you need to break it down in a little bit.
Yeah. Okay.
Because I don't think pneumothorax patients want to hear about what the specialist might do. Just tell him what you are going to do for him at this point. The oxygen stabilization of the patient, and after you feel like you're running out of time and you do not have anything else to say, just you can on your breathing and observation. You might need to involve the chest specialist to make sure you're okay, and we will keep you a couple of days and then you can go home.
Okay, so regarding stabilizing the patient, only, or what else we do? Because I didn't.
Oxygen, painkillers if he's in pain, but most importantly, you need to do the chest tube immediately. After that, he will completely, resolve. He will improve instantly after the chest tube.
Chest tube, yeah. Yeah.
Dr. Ravan, you did awesome as far as I'm concerned. You did really, really good. Your IPS was good. Just one thing is that, as Dr. Baha said, that involve the patient. That's what also I noticed, that even when you were explaining the diagnosis, right? Even when we were explaining the diagnosis, I didn't think that you involved them as much, right? Like you just said that you have pneumothorax, right? Like you need to ask them that if they understand it. Right. And then they said that, am I going to die? Your IPS was good, but, like make sure that they understand. Right. So involving the patient is one thing. Apart from that, you did good because you got on the diagnosis, you understood it, you did the right kind of management, you did forget about the painkillers, etc. But and also I guess in the middle, Dr. Baha, when you were, you're asking what is wrong, then he did say that, I just want to get better. Please give me some oxygen. I think he did say it somewhere, and you didn't listen to that. Maybe it was of the internet connection or something, and you just went on ahead. But you need to address that, right? Because if they ask for it, then you are in the accident emergency. You need to address that. Not in the beginning, maybe, Maybe in the middle, you'd say, all right, I see that you're worried and you want the oxygen and I want to help you as soon as I can. But before that, how about we examine you and make sure how much oxygen you need, right? Because we are about to, move to the next part. So you could just, like signpost there and maybe address that. That's all that I'm saying. Dr. Baha, you did ask her, right?
Yes.
Yeah. So yeah, like active listening. Apart from that, whether it's pneumothorax, yes, we're worried about it, but just getting the right kind of data, the history, I think that is more important, right?
Yeah.
Yes. All right. Okay. So
thank you for giving me the
anybody else?
opportunity to participate, doctor. Yeah, thank you.
No worries, Dr. Rahman. Why would you say that? We all are practicing together. I'm not running a group, right? I just want all of us to be here. And I love when we practice. I kind of like it because it just keeps me going. Right? Okay.
Yeah.
All right. So anybody else who wants to practice? If not, then any of you who want to, be the patient and help me, do some practice as well.
Excuse me, do you guys hear me?
Yes, Dr. Umar, how are you doing?
I'm fine. What about you guys?
I'm doing great. I'm not sure about others.
All right. So I'd like to practice. I'd like to be the patient or the doctor, but I just need 2 minutes. If you guys can wait for me, sure. If you guys can take another person.
So you need 2 minutes, right? Full 2 minutes, or you're just
yes,
saying
just 2 minutes. No,
okay,
just 2 minutes. I need to finish my writing. I'm at the hospital over here, and I'm just gonna come.
Right. Take your time. But if you are here, we're gonna continue, right? So I'll just do one station, and then you can come and do it with us, right? We're here.
Perfect.
Don't worry.
Perfect. Sounds good. Sounds good. Thank you very much.
No worries. So anybody who wants to do next, apart from Dr. Umar, or be the patient for me? Nobody wants to do anything? Dr. Bahar, do you want to be the patient or Dr. Rahman?
Yeah, okay. Yeah, okay.
All right. Okay, so whenever you're ready, we can do it.
Okay, so 35 years old Brad presented to the A&E with difficulty in breathing and cough.
Okay, and cough. Okay. He's in the A&E, he's 35, his name is Brad. Is that Brad Pitt or just Brad?
No, just Brad.
Okay, just Brad. Okay, works. So he's good cough and shortness of breath, right?
Yeah.
Okay. All right, I think we can do this whenever you're ready.
Okay, I'm ready.
If somebody else could do the timer thingy, because otherwise I'd be looking at it and it's not going to be of any use to me. Would anybody be controlling the timer thingy? Like look out for the timer. Dr. Robin, or anybody who wants to be.
Yeah, I can take the time if you want. No problem.
Yes, please. I'll be grateful.
Okay. When you're ready, let me know, okay?
Yes, I'm ready. I am ready.
Okay, 3, 2, 1, go.
Okay. Good morning. This is Dr. Hafsa. I'm one of the junior doctors here in the Accident and Emergency Department. Is this Brad?
Yeah, doctor.
You're right, Brad. I can see that you're coughing. So are you all right? What brought you to the clinic today?
Yeah, I've been coughing blood, doctor, for a couple of days now. I feel that I'm out of breath as well.
Okay, you're out of breath and you're coughing blood. I'm sorry. It must be very distressful for you. So, Brad, can you tell me a little bit more about this blood that you're having?
Yeah, doctor. Well, I've been coughing for like 2 weeks now. But for the last couple of days, I've noticed some, like a little bit of blood, and that's why I was a bit concerned,
Okay, so right, I see. Thank you so much for seeking help, Brad. So before we talk about the blood, can you tell me a little bit more about your cough? You said that started 3 weeks ago, and have you noticed anything else? When does it get? Is it there all the time?
Yeah, well, doctor, it's quite terrible actually. I'm coughing a lot of phlegm as well. So I took some, herbal remedies, but it didn't help at all. So, and after that, my difficulty in breathing started, whenever I do any like going upstairs or even walking, I get, out of breath and I need to take a minute to ease it out.
Okay, it must be very distressing, I am sure. Don't worry, you did the right thing coming here. So you said that you're coughing and you also having shortness of breath. So is there any particular time when you have this shortness of breath? Have you noticed when it gets worse, apart from you walking up the stairs?
No, just whenever I do any type of activity.
Okay, and you've been coughing. So and the blood, how long? When did you have it? Last time?
Yeah, like the last time was this morning, but I first noticed it like a couple of days ago.
Okay, and is the blood along with the sputum, or is just pure blood?
No, it's with the sputum, with the phlegm.
With the sputum, and you having this problem for the past 3 weeks, right? So apart from that, are you having anything else that I should know of?
Yeah, well, doctor, I just, I don't feel myself. I feel a bit tired and worn out. Yeah, I've been in the street now for 5 years now. It's been difficult, doctor.
Okay, all right. Can you say that again? Can you say that again?
Yeah, like I've been not feeling myself, been tired. I've been living in the street for 5 years now, and it's been difficult.
That's a long time. That's a long time. It is difficult, but Brett, don't worry. So have you noticed any fever, Brett?
Yeah, I feel a little bit hot, yeah.
Okay, all right. And you having fever and you're feeling tired. Have you lost any weight? Have you noticed that, you've lost some weight unintentionally?
Well, I'm not sure, doctor.
Okay, you're not very sure. All right. Has anybody around told you that you look a little weak or you lost?
No.
Okay, all right, okay. So you've been coughing blood and you've been having shortness of breath. You've been, having some blood in the cough. So apart from that, you're not having anything else. And are you having any night sweats? Are you sweating at night?
Yeah, actually, I've been sweating all day, doctor. Not, I've been, with this temperature, I've been like sweating a lot, and yeah.
All right, okay. All right. So is there anything that you're worried about right now, Brett?
I don't know, doctor. I just want to, to feel better.
Okay, all right, don't worry, we're here for you. So, Brett, since you are having all of these things, how about have you ever experienced this before?
No.
In your life? Okay.
No,
And have you ever been hospitalized?
No.
Okay. And do you have any medical condition that you're diagnosed with?
Nothing that I'm aware of.
Okay. And are you taking any medications for anything?
No, doctor.
Okay. And are you eating well?
Well, I'm a homeless, doctor, so I eat whatever I have, doctor.
All right. Yeah, that must be difficult. And do you smoke, Brett?
Yeah. Yes, doctor. I smoke, whatever leftovers I can find.
Okay, what do you smoke specifically?
Yeah, whatever I find, doctor, like cigarettes, weed sometimes.
Okay, all right. That is vital. Thank you for telling me that. And Brett, sometimes people who are, living on the streets and they're having these symptoms, we tend to ask some more questions, which would help us in understanding the situation. So, I just want to ask, are you using any intravenous drugs, right? Are you using any drugs through needles?
No. If you mean heroin, I've never used them before, no.
Okay, all right. Thank you so much for telling me all that you told me, Brett. I'm grateful that you came here and sought help. If it's all right with you, I'd like to examine you. Would that be okay?
Okay, doctor.
All right, so I'm going to do your general physical examination. I'm going to check you from top to toe. I'll be observing your vitals. I'll be taking your pulse, your blood pressure. I'll be also checking your oxygen saturation. And apart from that, I'll be checking your temperature. And if you allow me, I'd be also checking your chest. I'd go for inspection, palpation, percussion, and auscultation. Anything there?
Yeah, temperature 38.
2 minutes remaining.
Yes, just
1.5 minutes remaining, sorry.
Chest full of crackles and decreased air sounds.
All right. Thank you so much. Well, Brett, thank you so much for providing me with this information and, being here and being patient and helping me do the examination. Well, Brett, you said that you've been, living on the streets, which is very difficult, and you've been having shortness of breath, and recently you started coughing up blood, right? And when I did your examination, I found out that you're having some crackles on the chest and your temperature was a little high. When a person comes in with these kind of symptoms and signs, we suspect a condition called tuberculosis, right? Where what happens is that it is an infection of the lungs, and the person, they are infected with this virus, with this bacteria TB, and they have these symptoms that you have. Are you following me, Brett?
Yes, doctor. I mean, what you are going to do now? I just want to this cough to go away.
All right, yeah, I do understand, and I want to be here and make sure that you receive the best treatment, Brett. Well, right now you're in the emergency department, so what we're going to do is we can come up with a management plan, right? I'd be admitting you because you have shortness of breath.
Time is up. Time is up.
Time's up?
Yeah, time's up now. Just now.
All right.
Okay. Doctor, continue. I'm enjoying this conversation. Continue.
Yeah,
okay.
You can go.
All right, thank you. Thank you, Dr. Ba. Thank you, Dr. Rowan. So just give me one more minute, right? Let's see if I can wrap it up in one more minute, all right? Okay, so Brett, you said that you're having this, so you're in the emergency department. What we're going to do is we're going to admit you, right? And I'd also be concerning with my senior, right? Would that be all right if I admit you, Brett?
Yes, doctor, please.
Okay, all right. And after that, we'd be running some more investigations. Maybe we'd be going for, more blood tests, right? I'd be doing your TB, typhoid, your TB test. Forgot the name, by the way. And I'd also be doing your chest X-ray, right? And maybe I'd be, for now, because you are short of breath and you are having some temperature, so I'm going to give you some, anti-temperature medication, which are known as antipyretics. And once we have the results of your sputum test, we would be putting you on some specific medication. Are you following me, Brett?
Yes, doctor. Yeah, medication and oxygen. Yeah.
Yes. And apart from that, because you said you're smoking weed and you do smoke whatever you find and you don't have a healthy diet, we're trying with that. But at the moment, I would want you to be, I'd refer you to the specialist. And once all of that is done, we can, refer you to some facilities where we'd be talking more about, your smoking. Do you understand, Brett, what I'm trying to say here?
Yes, doctor. Yeah, it's already just been difficult time for me, and I lost my job and my family. Whatever you helped, whatever you think is help, doctor. Thank you.
Really sorry to hear that. It must be very difficult for you. And since you just mentioned that you lost your family and you've lost your job, there are ways we can help you cope up with that stress, right? We can refer you to some support groups in the beginning, and maybe we'd be, sending you to a counselor. Would that be all right?
Yes, doctor. Yes. Thank you.
Okay. All right. I went a little, didn't do much.
It was brilliant, actually. What do you think, if we involve I'm not sure if the social service might help him with his, his domestic situation. Like maybe they can offer him some, I don't know, some, anything to to find him a job and a place to stay. Yeah.
You know, that's my fault. I didn't ask anything about his job. I didn't ask about his, you know, because he did say he had a contact. I didn't even bring that up. I didn't do psychosocial. I've totally forgot that. As you guys blanked out, I blanked out too.
Yeah, well, for me, I think personally, especially in homeless, I don't think, you know, I don't think it's logic to advise him against smoking because he's homeless and, you know, it's difficult for him. So maybe we can, you know, tell him about, we can, you know, in 1 or 2 sentences, tell him about the importance of quitting. But maybe I can use the time in talking in ways how we can, you know, help him get his life together rather than talking about weed and smoking.
You're very right. I've never done this before. I've never have dealt with this homeless person, right? Because everybody who comes to our setups, they are all homeless, right? Almost homeless, even if they have homes. So, you know, it was kind of changed for me, Dr. Ba. But thank you so much for bringing this up, like this situation of a homeless person having TB.
Yes. Well, I think, you know, you sound natural. You doesn't sound like someone who's memorized the notes or anything like that. Your IBS is out of the chart.
Okay. Thank you for
Maybe, you
saying
know, maybe just, you know, have put the time in mind. That's it.
Okay.
You know, we do not want to be too comfortable.
That's right.
And at the same time, try, you know, to wrap things up quickly.
Okay. So what do you think I can do to wrap it up quickly?
Well, first we have to explore whatever symptoms the patient came with. But, you know, since you have like in brackets homeless, maybe we need to talk about this in you know, like a couple of questions about his home condition, like things regarding his homelessness, about contact history, you know, because, you know, homeless, they sometimes you know, gather in closed spaces or some, you know, like group of homeless stay together. So, you know, we can address that in a little bit details rather than, you know, asking about well, I don't think we can skip any questions here actually, but, you know, maybe we can ask the usual questions about past medical and lifestyle in as quickly as possible. But, you know, I think it will sound awesome if we can address the homelessness issue, you know, in a little bit
You're just saying. So Dr. Ba, if you were to do this, how would you address the homeless situation? Because I'm very unaware. That's all right
well,
with you if you could. Yeah.
I would say like okay, I would have the time in mind. Okay, so let's say I have 3 minutes or 2 minutes. I would just, you know, summarize what I'm going to do for him before I start. Okay, so I'll just, you know, I will tell him that there are, you know, we have to do a couple of investigations to confirm this, and, you know, and we can come up with a plan, with a management plan to treat your symptoms. But look, Brad, same time, it would be sensible to talk about your domestic problems, and we can help you, you know, with how to you know, get your life together. What do you think about that? I mean, if
That's
he said
awesome.
yes, if he said yes, then I would, you know, I would personally tell him the management as quickly as possible, because I think here the examiner know that all of us know the management, but not all candidates will talk about the homeless and how they can help him with the main issue, with the situation issue, not the condition, not with the condition issue, the situation issue. Because, you know, it's because he's homeless, that's why he got the disease. So maybe I can you know, rather than I would tell him about the investigations, about the admission, about the antibiotics, but you know, I would not talk about the, you know, the regime, the course regime in details, like 6 weeks or that. But I would like, you know, to have at least a minute to talk about the main issue here, rather than the TB. Okay, I've done with the TB long, so I would like to have at least a minute to talk about how we can help him get his life together. Maybe, you know, I'm not sure if social service is the right
You're saying the
one.
right thing. you're saying the right thing, but I was just thinking, like you are saying the right things, but like how would we phrase it, right? Like if we're dealing with this patient and he's homeless and he's got the TB, then how are we going to phrase the situation? For example, you said, like the patient, I didn't ask it, but the patient himself said that, he's homeless, he's lost his job and things like that. So how do we like address him? We're going to just say that, because you're homeless, what are we going to do about it? If he's homeless, what are we going to do about it? I'm genuinely
Dr.
concerned.
Hafsa,
Yes, Dr. Anu.
I hope you won't mind if I add something.
Why would I mind? We're not
Yeah,
here.
actually, I was, yeah, I don't know. I'm just a new here and I don't know.
We are
if
all,
somebody,
trust me.
yeah.
Yeah, go ahead.
Actually, maybe I was thinking, can we just say that, okay, what if we set up, what if I help you meet up with social services and they can find out how they can help you? And then deal with whatever is related to medicine in this case.
Yeah, I think that sounds good.
Yeah, and secondly, we can say that you are going to have a 6 weeks regime of antibiotics, and for the first 3 weeks, into first 3 weeks, you'll have to stay, take precautions and not come in contact with people around.
Okay.
These two things we can add, one leave things to social services and make other people safe around him.
Okay. All right. Dr. Anu, I think that sounds good. Dr. Baha, what do you think?
Thank you.
Yeah, I think it's brilliant, actually. Just summarize what you're going to do and then tell him about how we can help him with his issue, with his domestic issue. But also we have to advise him about, the contact and everything, because, you cannot treat homeless patients like normal patients, even if you advise him not to socialize or anything. I don't think like homeless will, take your words in it. But, it's just an exam, so we just have to say it.
All right, Dr. Baha, I think you're very right. I do agree with this. I think you're very, very right. I think we're going to do this that way. Thank you so much, Dr. Baha. You've been a huge
Thank you.
help, Dr. Anu, Dr. Raman, Dr. Atta, everybody, But we're going to continue, right, guys? Tomorrow we're also going to practice. I hope that's all right with all of you. I hope you're there.
Yes, tomorrow we'll do.
The time, like always, 3:30 p.m. UK time.
Yeah, almost.
Yeah. Okay.
But doctor, will we choose the topic before, or you will choose randomly tomorrow the topic?
I'm just going through the systems, right? Like the system thingy. So we did respiratory. If you guys think we're left with more of respiratory, then we do that. Or other than that, we have to move forward. And like the next thing that I have on here is, let me just tell you, because we're doing system wise. We did CNS earlier. I don't know if you guys were there. We did CVS. The next thing that we're going to do is, GIT. So questions related to that. But right now, I think we're still to, do the respiratory problems, right? Like I said, we could talk about, an elderly who is having, tuberculosis. We can do asthma, flu vaccine, maybe talk about the management of a person who's already been diagnosed with asthma, right? So like counseling of a person who's been diagnosed with asthma. So tomorrow again, we'd be doing respiratory, and after that, we'd be doing GIT, inshallah.
Okay.
Okay, folks, I think we're going to call it a day, even though it's nice here.
Thank you so much. Thank you so much, Dr. Hafsa. Thank you so much.
Thank you so much. Have a great day, guys. Thank you so much.
Thank you.
Love this. Have a great day. Bye. Thank you so much.